Thanks, Helen. In terms of collaboration with US and US institutions, it has been going very well on the technical side. We've been exchanging information. As we are speaking right now, the US CDC has been joining Guam, so are the state. So the information flow is there, transparent and frank, and information sharing. That's one on the technical side. On the other aspect, there's the IHR, the IHR channel. US is still a state party to IHR, and information is being shared through South Africa. NFB communicated with the US, and back and forth communication is going on. But how does that translate in a global solidarity? I will let time to tell, but we really need this incident, this outbreak has seen why the world needs a global entity that coordinates this. The Argentina support how they came forward. The support we are receiving now from US institutions. We live in an interconnected world. That outbreak from one part affects everywhere. So in terms of collaboration, we are going both through the technical collaborations, in sharing information, guidance. We rely heavily as DG multiple side. What I'm saying is that the expertise of US CDC is an asset for the world, and we have been benefiting from that, and we will continue, and then we go through the IHR channels in sharing formal information and the technical exchange.
And Anaïs Legon, please.
Yes, I just would like to emphasize the excellent collaboration on a technical standpoint to date with my counterpart at the US Center for Disease Control. And this includes sharing of technical assessment, discussion about, very specific aspects, and sharing regularly what is known and what is not known. We have very positive, regular interaction almost every single day. So I just want to acknowledge that among other national counterparts, this is very useful.
Thank you very much, both. Now, oh, pardon me, again.
Yeah, no, I just wanted to add to what colleagues raised. Thank you, Helen, for that important question. As we speak, things are going actually as it used to be, meaning sharing information from our side. And also we're getting information from the US side based on the IHR regulation. And as you know, the WHO's mission is to, help the world to be safe. And our mission includes the US, which is we want the American people to be safe as well. So we will continue to collaborate from our side and continue to give information. So the disease is not a problem in the US and the rest of the world as well. But as colleagues indicated, the best immunity we have is solidarity. So because of the event that's happening now, and both Argentina and the US are affected, I think they will reconsider their decisions because they can see how important universality is for health security. Because viruses don't care about our politics, and they don't care about our borders, and they don't care about, all the excuses that we may have. So I hope this could be a good lesson for the whole world, because solidarity is our best immunity. I repeat. Thank you.
Thank you very much, Dr. Tedros. Then now we go to Ireland, to Neil Michael from the Irish Examiner. Neil, please go ahead and mute. Do you hear us? Are you still on? Neil, if we can't grab you right now, then we go on to NPR, Gabriel Emmanuel. Gabriel, please try and we'll come back to Neil afterwards. No? Oh.
Hi, yeah.
Here you go.
Thank you so much for doing. Thank you for doing this. I wanted to follow up on that point about the U.S. Engagement here. typically, my understanding is we would have had press conferences and health alerts and other information coming out of the US CDC and NIH. We haven't had that, and I'm wondering, you say they're participating in terms of a technical capacity. Have they sent a team over like would typically happen? Can you get into some more specifics about what is missing or what is different about this situation now that they have left? Thank you.
Thank you very much, Gabriel. And we go to Dr. Abdi Mahmoud. Or Dr. Chikwe Kwazao first.
So thank you very much. Our colleagues have explained in detail the collaboration with the US CDC in the response that we have managed on behalf and in collaboration with many countries around the world. And we're very grateful for that. How many teleconferences they hold to the people in the US is obviously the responsibility of the US and the US CDC, and we'll leave that responsibility to them. But however, to highlight one thing, one of the core requirements of the IHR 2005 is for countries to build the core capacities that they require to do the work that we do. And in this response, we've really seen the output of that. The institutions across the world and the collaboration between them, from South Africa, the UK, Spain, Netherlands, Cape Verde, the national public health institutions, the national public health officials have really worked together with each other, supporting each other, sharing information, sharing reagents, sharing knowledge to respond rapidly to an emerging situation. So I think in all of this, we see the value of one, the IHRs and what it stands for, and secondly, the implementation of the IHRs, both in real time, but also in the longer term capacities that countries have built around the world. And it is on that we build this universality that our Director General just commented on. One is the principle of universality, but secondly is the implementation of it through the institutions that represent that in all the countries around the world. Back to you.
And now Dr. Mahmoud, please.
Dr. Tedros and Dr. Chikwe has covered the main point. I just wanted to answer there so that we have clarity. And it repeats again to the other question, is this pandemic, is epidemic, and how we deal with it, and how US institutions like US CDC is dealing. These are limited epidemic confined in a cruise ship. Idea of sending messages across the world and panicking everyone is not required. And I think I want to take those with the contacts and the passengers in the US being contacted and traced. We believe so. And we haven't formally heard from that, but informally we are aware that rightful action is being done. So there's no need of panicking the entire population there and creating this, the largest epidemic is going to happen. So I just want to take this opportunity when we look at comparing institutions like that, are there public health actions being taken in each of the countries where NFP South Africa has shared? Yes. Are we getting feedback? Yes. And each country will have a different approach how they deal with it, and that's their own. So I just wanted to take that point answering the specific question, how is US CDC, why is no alert being sent? Because what we have there are passengers who are contacts who went back to the US who are now currently being traced by the local authority, sharing information to US CDC, and hopefully through the IHR channel, sharing back information to WHO.
Thank you very much, Dr. Chikwe, Dr. Abdi. Next question, we try again with Neil Michael from the Irish Examiner. No? Has dropped. Then we go on to Janice Koo from Bloomberg in South Africa. Janice.
Hi, thanks very much. I wanted to find out how long does it take to get the lab test results for the Andes virus currently, and is a specific assay needed? Just related to that, and some clarity on an earlier question, the KLM flight attendant who had contact with the second patient who died, that flight attendant's been hospitalized in the Netherlands, and I was wondering, is she symptomatic, and when can we expect to know her test results?
So first was about time, and then, yeah. Dr. Anaïs Legault.
No, doctor. Thank you. Yes, this is a very important question about how long it tests. The tests are are performed. So the PCR is a technology that is being used, and countries are scaling up their capacity to ensure there are the adequate reagents. As you know, this is not a very common virus, so we are supporting countries to ensure there is the capacity to test should they have alerts. If reagents are available, the PCR performed is fairly quick in a matter of hours. And just to mention as well that there will be complementary testing using serology, which we are also helping countries to prepare for. That's for the first question.
And just on the second question, very briefly, so it adds on to what Anais has just said. It depends on the type of test that's actually being done. Certainly any of the contacts, including the one that you've mentioned, the flight attendant, will be isolated and testing will be done. I don't have a specific time for when the test will be back, but we are in regular contact with the Dutch authorities to receive that type of information. So as soon as that is ready, it gets reported back to us as well, and of course to the patient themselves. But it will depend on the type of sample that's done, the type of test that's done, for the timeline and when the results will be back. But I can assure you that everybody that is involved with this is just as eager to do the testing as quickly as they can, as long as they have the right materials. And again, we are supporting several countries with reagents to be able to test for this Andes virus. And as Anais has said, this is not a very common virus, mainly found in the Americas. So we're trying to provide support as one of the functions of WHO to ensure rapid diagnosis of any person that is tested for this.
Thank you very much, both. Next we go to Le Monde, Delphine Roucault. Delphine, please go ahead and unmute. How does it look like? Then we're...
Can you hear me,
here you go.
please?
Now we're good, yes.
Yeah, perfect. Thank you for this briefing. I just have a question. When will we have more information about the virus sequencing, and any differences observed compared to the strains from the 2018 outbreak in EPN that you mentioned earlier? Will we be able to identify which mutations are cause for concern? Thank you.
So I did not understand everything, but I think we got it. Yeah, then we start with Anaïs Legon.
Yeah, if I understood correctly, it's about the genomic sequencing, and you actually pointed out toward very interesting information that we are looking at. We are awaiting the result from both South Africa, Switzerland, and Institut Pasteur Dakar, who are all putting all their effort into performing the full genome sequencing of that virus. The full genome sequencing, if good coverage is obtained, will be very useful for us to see how it clustered compared to previous outbreak, as you rightfully mentioned, especially that last outbreak you referred to. And it will give us a sense of whether or not we are seeing some changes. And again, we have to acknowledge the tremendous work that are being done by these three laboratories that I mentioned, and all the international support that they have received to date.
Just want to add to that, because I think, again, this is another example, of having rapid sequencing being done by these three labs who are really exceptional labs. But the sharing of sequence information, particularly when you have outbreaks like this, can provide a tremendous amount of detail. And this is important every event that we have. Not only are they doing this work as rapidly as they can, but we have pulled together expertise in Andes viruses, and they will be debating, of course, what they see there and comparing with the other sequences that have been shared. We discussed this a lot up on this panel here, and we've been discussing this a lot with the pandemic agreement and the PABS annex that people have been discussing, the critical importance of sharing information, but not just that, actually bringing together people to do that risk assessment. What does it actually mean? So from the information we have so far, and they're still doing the sequencing, we haven't seen anything unusual, but that's why we bring together the best minds to be able to do that. And again, that includes people from Argentina who have specific experience with this particular virus, and now we will have more people around the world. So as soon as we know, and as soon as that analysis is done, of course, we will share that information as necessary.
Thank you very much, both. Now we move back to Germany. Deutsches Ärzteblatt, Valentin Frimmer. Valentin, please go ahead and unmute. Valentin? Otherwise, we come back to you. No, you're coming? If we don't get to you, here we go.
Can you?
Yeah, it's
Sorry. Hey, Valentin Frimmer, Deutsches Ärzteblatt. Thanks for the conference. My question is, so we've learned already that the incubation time is relatively long. So my question is, so with the view on the people in isolation, how long do they have to be in isolation before they are tested negatively? Because so, or in other words, how much time does it take at most until the antibody or PCR tests are positive? I hope this was clear.
Thank you for the question. We start with Anaïs Legault.
I hope I understood your question correctly, and sorry for that if I didn't. Your question is how long after symptoms is the PCR detecting the RNA? Is it correct?
Or how long would people need to stay in isolation to be sure that they're not infected?
So what we know is yes, the incubation can be up to 6 weeks. And for that time, contacts who have been potentially exposed need to monitor their health for any sign of symptoms. The RNA of the virus can be detected in a symptomatic person, so someone who is healed, from the first day of onset.
Thank you very much. Next question, we go to Globo, to Brazil. From Globo, Bianca Rotier. Bianca, please go ahead and unmute.
Hi, can you hear me?
Very well.
Thanks a lot. Good afternoon, everyone. A follow-up on this point, because you said 6 weeks monitoring, but does it mean 6 weeks of isolation? And now my main question, what is the mortality rate of the Andes strain of hantavirus? And just as I'm covering this story for the Brazilian television, my understanding is that the Andes strain of hantavirus is also present in Brazil, correct? So should Brazil's health authorities reinforce protocols for cruise ships after this case? Thanks a lot for your attention.
So the first was the specification on the 6 weeks, and then the question whether Andes virus is also present in Brazil, and whether protocols should be adapted.
And the mortality. Yes. So maybe I will start with the mortality, and I might let colleagues to complement on need to safe and adequately equipped with trained staff to ensure that patients can receive the level of care that is needed in case they present severe presentation and deteriorate. So hopefully with early care, survival can be improved. In terms of virus circulation in Brazil, I'm not sure if there was a question, but any country who have hantaviruses, not just Andes, should obviously scale up their surveillance system and One Health approach to understand where this virus, in which, animal, rodents, the virus circulate, and ensure that interaction with rodents can be minimized or conducted safely to avoid rodent to human transmission in countries that have the virus present in their reservoir.
Thank you very much. Maybe to add on the hantavirus as such, and
the question,
yeah.
yes. So no, thank you very much for the question. So Anaïs had described earlier, and we'll talk in general, but then specifically about the situation with the ship and the people who are in contact. Certainly, we have the incubation period of up to 6 weeks. That doesn't necessarily people need to be in isolation for 6 weeks. What is really important is that people have the right information. We understand what their potential exposure is so that we can understand their risk. Contacts are not all the same. Some contacts have a higher risk of exposure and therefore a higher risk of infection, and others have less. So what is happening currently right now on the ship We have a WHO expert who is on board, together with an ECDC expert. We have two Dutch infectious disease physicians who are on board. They have received protocols. They're asking questions related to the exposures of the people on board to really understand, what type of contact did they have with any of the suspected cases or confirmed cases, and what did they generally do on the ship before they got on the ship, during on the ship, and then looking at what type of exposures and what type of risk that means. With that risk assessment that's being done, there is a step-by-step plan that is being developed, and it's currently in develop with many different experts to be able to say, once that ship docks, what will happen as it goes on board. So that is currently being developed now. What is really critical is that people have the right information. This also includes people who disembarked in St. Helena, people who have been on board. If you are developing any symptoms, to present yourself to healthcare and just say, this is my potential exposure, might be hantavirus, and then you'll be isolated and tested and provided care. So what we're trying to do is take this in a staged approach. But I do want to reiterate, contextually, what we're talking about. The risk to the general public is low. Hantaviruses are relatively uncommon, even though there may be thousands of cases estimated each year. This is a particular situation where we are monitoring. I think it's great we're raising awareness about hantaviruses in general. It's great that countries are paying attention to this, and hopefully governments and increasing their surveillance efforts and really critically using this One Health approach, because it is predominantly in rodents, and that's how people get infected. So this is why, as Chikwe has said before around the IHR, the core capacities in countries for early detection, good surveillance, having good public health systems is critical. So whatever is circulating there, we have the right facilities in place to keep people safe.
To infectious, we are recommending right now active monitoring. What does that active monitoring means? Each country will have a different approach. Some countries are now introducing institutional quarantine where people will be put, but we have to remember most people don't have. Putting people in 6 weeks are different. So we leave that decision from our WHO side. The most highly are the cases and confirmed which needs to be isolated, and then the contacts needs to be followed, duration up to maximum of 40. How does that happen? Active monitoring is the daily visit by healthcare workers. Is it we put in an institution? It will change. Just to break the chain of transmission, we have two different approaches. One is the isolation of confirmed cases who we know they have infections, and people who are at risk who have been exposed, where we call active monitoring. And different countries use quarantine, institutional quarantine, and all that policy. I just wanted to separate what WHO is recommending: isolation of the confirmed cases and the active monitoring of the exposed people who may be at risk. How is that implemented? We may change from one country to another, and then take the maximum duration of the 42 days. If you look at what we have seen right now, within 2-3 weeks, the people, when they got exposed, they had the onset of disease, but the clear guidance shows up to 42 days. So that's the maximum that we are recommending, active monitoring of those people who have been exposed.
Thank you very much to all the three of you. Now we come to Politico. Rory Neal. Rory, please go ahead.
Hello, thanks very much. Yeah, I'm just curious about what happens when passengers disembark. Okay, you just clarified your guidance on isolation there, but like, should passengers be going on commercial flights back to their countries when they disembark, and would you have any concerns around that? Yeah, thank you.
So the question: how should the passengers now who disembark, how should they move on with it?
I will start, and probably my colleagues will complement me. Yes, a step-by-step guidance is being developed to make sure that all passengers and crew members are supported throughout this journey. Don't forget what they've been through. And so WHO is coordinating with national health authorities to streamline recommendation and guidelines on that, and to ensure that first, as my colleague says, that anyone who would have any sign or symptoms can be properly isolated and cared for, while all passengers are being evaluated for their risk exposure to to be able to inform them on what are the recommendations moving forward. So this is still work in progress. The evaluation is already ongoing in the boat, but further guidance is being streamlined and developed.
I think if I could just add to that, so as you know, there's a lot that's currently being discussed right now. I did want to specifically mention that we are working with all of the countries who have nationalities that are on board to discuss the plans for the safe journey of those patients home. Once they disembark, once they are medically evaluated, what those decisions will be. And as Anais said, that is currently being developed. It needs to be very carefully done, but we are working with the countries about that onward passage home. So I just want to assure, and we are also working with the ship's operator because of the crew. So remember, on board, we have passengers from many different countries. We also have crew from many different countries, and everyone involved, all of the governments, the ship's operators want to make sure that they get home safely, not only minimizing their own risk, but any risk to others. So that is currently being developed, and as those plans are announced, then we will make those available. But there's active discussion about how that will be done as safely as possible.
Thank you very much, both. Next, we go to the Globe and Mail. Mustafa Al-Assar, please.
Hello, can you hear me?
Well.
Thank you so much. I appreciate your time. Can I ask about the medical condition of the Canadian passengers, including the 2 Canadians who have been evacuated in April? And you have mentioned that all governments, you are in contact with all governments. Can I ask whether the Canadian government has been in contact with the WHO regarding their safety or evacuation? My next question is, what is the WHO protocol for contact tracing in details? And also, we have been monitoring 2 live streams from the ship. In one, the streamer appeared distressed, was crying and was asking for help. In the other, the streamer seemed calm and they stated that people on board were not under stress, take the situation seriously, but without panic. He said to us that the situation appears to have been extremely overstated. Could you please clarify this contrast? Thank you so much.
Thank you, Mustafa. A bit more than one question, but let's see.
I heard 3. I'm not sure if I got the first question, which I think was related to Canadians if we're working with the Canadian government. We are working with all of the governments. I mean, this is what WHO does, right? We are a member state organization, and we work with all governments, and they are working with us as well about the people who are on board. I think your last question, I didn't get the second question, but I think your last question was around the passengers who have either live streamed or said that they were under some distress on the ship. Yes, we've seen videos, we've seen that video, and in fact, in some earlier interviews, I was trying to address directly the passengers that are on board because we hear them. As you know, the DG has been in contact with the ship's captain several times and discussing, you know, the captain is doing the best that he can to provide the right and appropriate duty of care for those people who are on the ship. We hear them. We are working with many, including, you know, everybody on board to ensure not only do they have medical support, and that's why there are 2 additional infectious disease doctors from the Netherlands on board, but also providing some psychosocial support as well. This is quite frightening for those who are on board. They want to have the right information and regular information about what's happening. Our understanding right now is that the morale has improved because the ship is moving and plans are being made to get them safely to shore and for their onward journey home. So yes, we have heard that, and I think what you highlight here and what I would like to emphasize is that it's not only the clinical care, but it's also care for people's mental health. And it's really about making sure that they have good information so that they can take action, because of course there is a worry on the ship, but we understand there's also a worry out there. And again, this is why we're trying to answer questions to just put this into context of what is actually happening. And again, the risk to the general public is low.
Thank you very much. And I think, although we have still many questions left, we are ready to take one more, and that one goes to Sarah Nui from The Telegraph. Sarah, please go ahead.
Hello, thank you so much for doing this. I just wanted to talk quickly about medical countermeasures. There obviously aren't any treatments or vaccines available. Is that a blind spot in global pandemic preparedness? And which teams are kind of furthest ahead? If this did escalate, how quickly could we get a vaccine, for instance? Thank you.
Anna going again.
Yes, thanks. Very important point. Currently, there is no approved medical countermeasure if we are referring to antiviral treatment or specific vaccine targeting this specific virus. However, as you know, there is a coordination around research and development blueprint that is supported by WHO to ensure that all priority viral families can timely develop such countermeasure. And the antivirus are a big family that is considered under a cork, what we say. So WHO encourages scientists and countries to join efforts and to see how feasible it is to develop life-saving countermeasure. But I want to re-emphasize the importance of early, supportive and intensive care as soon as possible as a patient has symptoms, as this can save life. And of course, we welcome additional countermeasure. I leave my colleague.
If I can, yes. So the R&D blueprint for epidemics, which was established by WHO following the Ebola outbreak in West Africa, in 2017, we outlined priority pathogens. And from there, these are priority pathogens that have an epidemic or pandemic risk that didn't have medical countermeasures. And a lot of work has happened over the last almost 10 years related to the development of better diagnostics, better therapeutics, better vaccines for pathogens that we know have a risk. Recently, the R&D blueprint has moved to more of a pathogen family approach so that we take a more holistic view of how research is done to advance, what could be done ahead of time, ahead of that next outbreak, ahead of that next pandemic. We benefited from that from COVID, for the work that was done on SARS and on MERS and on RNA technology. And this is what we want to continue to see. So that investment in research, that investment in innovation, the investment in the coordination of people who are working on this. We're very grateful for that from a technical point of view, the work of CEPI, the work of many others who are advancing this type of work. But that needs a regular attention, regular investment, and also follow-up. So what are we learning? What actually needs to be done? So the R&D blueprint is working very hard on many different types of pathogens with epidemic and pandemic potential. And as Anais has said, this is one in a family of viruses where this approach is being taken. So those of you who are out there who are doing research in this area, thank you very much. Those of you who are out there who are funding research in the area, please continue to do so because it is urgently needed, because we are always preparing for the next outbreak, the next epidemic. And I want to reiterate again, this is not the start of an epidemic. This is not the start of a pandemic, but it is a good opportunity to say that investment in pathogens like this are critical because therapeutics, diagnostics, vaccines save lives.
Thank you very much. Before I hand to Dr. Tedros for closing remarks, let me just say, any further questions, please send to us, thanking the panel. And then now over to Dr. Tedros.
No, I was going to add to the question about Canada. We know that the Public Health Agency Canada is following up on the 2 Canadians who have disembarked at St. Helena. And of course, the other 4 in the ship are also being followed by other relevant authorities of Canada. That's one information I just would like to add. And then on closing our session today, thank you so much to all members of the press for joining us. And as needed, we will continue to keep you updated. Thank you so much. All the best.